I'm Dr. Paul Putterman, and I practice in both Charlotte, North Carolina, and Gastonia, North Carolina. I did my undergraduate in medical school at University of Virginia in Charlottesville, Virginia. And then I did an internship and residency in pediatrics at what was called Charlotte Memorial Hospital. It's now Atrium Medical Center in Charlotte. I was the senior partner and founder of Matthews Children's Clinic in Matthews, North Carolina, which is just outside of Charlotte. And that grew into a 10-doctor practice of pediatrics before I left. I was board certified in pediatrics in 1981, and I left pediatrics to join Vein Clinics of America in 1997. I trained for 3 months in the Atlanta clinic and then opened the Charlotte clinic of Vein Clinics of America in February of 1998. Board certified in phlebology, and I accomplished that in 2009. And I remained at Vein Clinics of America until October of 2015, and then joined Vein Specialists of the Carolinas part-time in April of 2016. Well, I had no intention of ever leaving pediatrics, but I was recruited by a physician who was in family practice here in Charlotte, and then he had moved to Atlanta to run the Vein Clinics of America clinic down in Atlanta. He knew me, and when they decided to open a clinic in Charlotte, he approached me specifically about moving to vein treatment at that clinic. I knew nothing about it, but I found it kind of interesting and exciting to work in a field that was fairly new at that time, because that was a long time ago. And the only treatment available at that time was surgical stripping, which all I knew was there were plenty of horror stories about that. My goal is to educate the patient on vein disease, because so many patients come in with so many symptoms, and they've been minimized over the years by most physicians who are unaware of problems that are associated with vein disease. When I spend the time educating the patient, then I'm rewarded when they can thank me for all that I've done for them, and that, somebody now recognizes all the symptoms that they've been having for years and years and years. Well, my job is just really education. It's to help the patient understand what vein disease is, why they're having the symptoms that they're having, and then to make it easy for them to understand the treatment that we're doing and why we're doing it to get the desired effects that they want. Every patient I see is important to me. That's the real gist of everything. I really listen to what they're feeling. I try to validate what they're feeling and that their symptoms are real, because so often physicians have just sort of, kind of ignored what they're saying when they tell them their legs hurt or they're swelling or anything like that. And I just at the end of treatment, I want the patient to tell me that this has been the best thing they ever did.